Now to a health alert. Measles cases in Michigan are raising concerns for families with the new school year just around the corner.
The Michigan Department of Health and Human Services just updated its measles dashboard, showing 14 confirmed cases reported in Michigan so far this year.
Nationwide, the measles outbreak continues to grow, with nearly 2,000 cases reported across the U.S. this year. Earlier today, we heard from the chief medical executive for the state of Michigan.
We've got some Michigan classrooms reopening as early as August 17th. And this is really the time that we've got to start thinking about vaccinations and those back to school types of things.
Now, measles cases in the U.S. have reached their highest level in 35 years. Our chief health editor, Dr. Nandi, joins us now. And so why is this spreading so much now?
Yeah, it's important. Right? Measles is one of the most contagious viruses in the world, as we know. If one person has it, Heather, up to 9 out of 10 folks nearby who aren't protected can become infected. And why? That's because the virus can remain in the air for about 2 hours after an infected person leaves the room, and it can spread even before someone knows they have it, from up to 4 days before the rash appears. And data shows this, that 93% of this year's measles cases have been in people who were unvaccinated. Unfortunately, we're seeing vaccination rates decline, and even a small decline can create pockets where the virus spreads more easily. Now, I've heard my patients and parents say that they think of measles as just a childhood rash, but even with modern medicine, measles can sometimes lead to serious health problems and even death. About 7% of cases require hospitalizations. Complications include bad stuff like pneumonia, encephalitis, or swelling of the brain. And sadly, last year, there were 3 deaths from measles. One was an unvaccinated adult and 2 kids who had no underlying health conditions. One concern is that if vaccination rates continue to decline, we could continue to see larger measles outbreak throughout the winter and spring months.
Certainly frightening. So what advice do you have for families, especially as kids head back into the classroom where they're all around each other? Exactly,
and giving themselves all kinds of stuff. Right? My advice is to check your child's immunization record and make sure they're up to date before classes begin. Both the CDC and the American Academy of Pediatrics recommends 2 doses of the MMR vaccine. That's the vaccine that protects against measles, mumps, and rubella. And the first dose is usually given between 12 and 15 months of age, and the second between 4 and 6 years of age. Super important to get both doses. Why? Because they're about 97% effective at preventing measles. Now, if you're unsure of your child's immunizations, just please reach out to your pediatrician's office. They can review your child's records and answer any questions. Taking a few minutes to do this before school can start, help protect your family and others in your community. And babies, young children, and adults can be at higher risk of serious complications and even death from measles compared to older children and teens. I'm a parent, and I know that the weeks leading up to the back to school are super busy and hectic, but I strongly recommend childhood vaccinations. And my kids are definitely up to date, including the MMR vaccine.
Yeah, get those appointments in now while you
Exactly.
can. Great advice. Thanks, Doc.
Sure.
Well, this week on the Dr. Nandi Show, Dr. Nandi welcomes guests who faced life-changing cancer diagnosis and chose different paths to healing. A stage 3 colon cancer survivor shares why he declined chemotherapy and the lifestyle changes he credits with his recovery. Tune in Sunday, August 2nd at 5 p.m.